thanks for tuning in to the Oxygen Alliance YouTube channel, where we share the Concentrator Talk virtual meeting hosted every Thursday from 2 to 3 p.m. Central African Time. In the talk, we discuss different aspects of oxygen concentrator assessment, use, and maintenance. And please don't forget to subscribe and hit that notifications bell.
Hello, everyone, and thank you for joining us for today's Oxygen Talk brought to you by the Oxygen Alliance. My name is Amarpreet Rai, and I am currently in New York. And today I am joined by our usual technicians and colleagues from Open02 and Sanrai. In case you are joining us for the first time, the Concentrator Talk is a virtual meeting that the Oxygen Alliance hosts every Thursday from 2 to 3 p.m. Central African Time. And here we discuss different aspects of oxygen concentrator assessment, use, and maintenance. Once a month, we host a unique series where we invite experts to come in and discuss with us, instead of the usual concentrator talk, anything related to oxygen focused in our markets. So with our usual programming, if you have any problems regarding oxygen concentrator maintenance or assessment, we always encourage you to send the questions to us in advance through our email, info@oxygenalliance.org, and we will do our best to help you as we can. If you have any questions during this call, you are welcome to ask them in the chat, or you can hold them until the end, and we will get to your questions there. So today, it is my pleasure to introduce our experts of the day for our Oxygen Talk. And we have here with us today the Oxygen CoLab. So the Oxygen CoLab is a partnership between Brink, DT Global, and UNICEF. It's funded by UK Aid and was initially set up in direct response to COVID-19 related oxygen shortages. Today with us, we have Lynne and Harry, who both work for Brink, which is a global behavioral innovation consultancy. Harry joined Brink and the Oxygen CoLab program earlier this year as an innovation manager. He provides coaching to the program's grantees, sharing evidence and learning, and bringing together those working in the oxygen space. Prior to joining Brink, Harry spent 10 years in the London market insurance industry, handling complex commercial property claims and innovating within the sector. Lynne is the Oxygen CoLab lead. She joined Brink 18 months ago as an innovation lead. She is responsible for the strategic direction of the Oxygen CoLab and provides support to the operational team. She is a cardiac nurse by background and worked in the NHS for 20 years and has experience in policy influencing and implementation. We are really, really excited to have you both here with us today. And I think everyone here is quite looking forward to learning more about what you guys are doing. And with that, Lynne, I will turn it over to you.
That's great. Thank you so much for the introduction, Amarpreet, and thank you very much for the invite as well. It's fantastic to be here describing what we want to do and also inviting you to be part of the Oxygen CoLab. So I'll just share my screen. And there we go. Hopefully you can see the presentation.
Yes, we can.
Fabulous. So we are the Oxygen CoLab, and we are part of the Better Futures CoLab, and we'll share some more information with you after about what that is. Today, what we want to talk to you about is a bit about the Oxygen CoLab, and that will help us lead into the product versus service conversation, and I'll describe that a bit more. So the oxygen concentrator and also the wraparound service that's required to support it. We're then going to talk to you about two really key tools that we think will be very helpful for your day-to-day, but also we'd love you to get involved with, get involved in the conversation. So that's the Oxygen Concentrator Target Product Profile, the TPP, which has been published by UNICEF, and also an oxygen concentrator usability study that the Oxygen CoLab commissioned. And Harry will describe a little bit more about why that's useful and why we decided to go into this space. And then we'll invite you to be Oxygen CoLabers and talk to you about what that could mean. So the Oxygen CoLab is working together to get oxygen concentrators to market. We knew they were breaking down throughout the COVID-19 crisis. They're not being used for their particular use case, which was in the global north. And we believe that we can support a better environment to enable better, more fit for purpose oxygen concentrators get to market. And the problem we want to solve is, how do we accelerate global access to oxygen? And this is specifically in low resource settings, so the settings that you're working in. And can we do this by working on the market, so making sure that we understand the demand and the need, and also then supporting technology issues, so product development that's needed. And we're doing this through a number of different mechanisms, and this diagram tries to describe that. So what we're wanting to do is increase people's commitment to actually working in this space. So we all know that the current oxygen concentrator breaks down. It's not used to the conditions that it's currently being used in. But we need people to commit more resources and time to actually improving their product, and making sure that they're interested to stay in this space. We want them to take the risk. To do that, we need to ensure that people understand that it's needed. So what is the use case of the oxygen concentrator? Who needs it? Which patients will it benefit? Who will be purchasing it? How many will be purchased? And so we can build knowledge around market traction. And we're doing this through Oxygen as a Service. Amapreet and Sunrise are running one of these pilots in India, and I'll talk to you about some of the others as well. Alongside this, we're looking at whether there are financial mechanisms that can help. So how can we stimulate the market? How can we purchase these products to enable them to be innovated? So put some money into this space. Then the other element is increasing capability. So we know there are lots of product innovators out there, and there are also big manufacturers that are interested in this space. So what can we do to support research and development? What are the particular blocks and barriers? Can we help to share research that's happening in this space so that others can learn and develop off the back of that? And then the other element to kind of intertwine these two is, how do we enable a collective response? And it's exactly what you've been doing as part of this Oxygen Alliance. So it's bringing people together, having those great conversations, solving problems together. And then we can amplify and accelerate the work that's being done. So we want to generate momentum, bring people together, and really help to support these new innovations going forward. So just to kind of give you a flavour of the things that we're funding as the Oxygen CoLab. So we're funding for product innovation, research and development. So that might be smaller innovators, but it could also be larger manufacturers that have a particular problem that they're trying to solve. As part of that, we may also be doing field trials, so actually taking new products in country to make sure they're being used in the use cases that they're designed for. But we're still kind of in design phase of that. So we'll be doing a call out to kind of our entire audience, the ecosystem, to see how we can benefit people in that space. We'll also be doing lab testing, and this will fit really nicely with what Harry's going to describe in terms of the TPP. So we know that current products are not fit for purpose. We're going to put them into a lab and test them against the conditions that they should be working well in. And then we'll understand what the gap is. Why are they breaking down specifically? How close are they to being fit for purpose, and what changes are needed? And these are probably things that you know from your day-to-day activities as well. So anything you can feed in after Harry's part of the talk, that would be fantastic. The next element we'd like to also do is, once we've funded research and development for these products, what can we do around lab testing them? So how do we help them progress their development? How can we help them with medical device regulation and actually getting to the point where they can be manufactured and produced? And then the other elements are the catalyzing market traction. So this is our big Oxygen as a Service pilots. And we've done some learning network events on this. So it'd be great if you weren't able to attend, we have some recordings that you'll be able to watch. So we'll share the links to those. We've currently got programs in Tanzania, that's through 302, and Sunrise in India. And we're just about to extend the portfolio. So we'll be working in Kenya, Nigeria, Democratic Republic of Congo, Uganda, and the Philippines. And this is an effort to really understand the different contexts. There's different political environments, different economical environments, there's different drivers to helping develop business models in these countries. So it'd be great to understand what the context is, what can we share, what's the same, what's different, how can we understand that? so that we can all amplify each other's work. And then, of course, there's the financial instrument, which is definitely a work in progress at the moment. So this is the final slide from me, and it's trying to kind of weave the two together of the importance of the product and the service. And we really need to get the balance right to make sure that we're spending our money as well as possible. And that's in the future as well. We're investing in the right things. So procurement are investing in the right things. Governments, ministries of health are also spending the money in the most effective way. So we know the oxygen concentrator is an invaluable source of oxygen. There will always be a role for this product. And there is interest in innovating it. There are lots of brilliant ideas about how to make this fit for purpose. And innovators are currently doing that right now. And we're hoping to support them to accelerate this. However, this is very expensive, people, if there's no clear market. So that's why we really want to test that kind of market, the demand models. So as you guys will be absolutely aware, the wraparound service is also vital, but it could be costly as well. It is more than product, it's about education. So how do we ensure clinicians are able to diagnose, treat, and provide that aftercare? How do we make sure that oxygen is used effectively for the right people in these situations? How do we make sure these devices are maintained? This is your day-to-day role. So how regular does it need to be? Making sure that it's preventative rather than reactive. How do we make sure people are trained and supported, and that these roles are paid for, so that it can be continued? And then the business, how do we fund the operational expenditure? So all of this element together, how do we put a cost on that, a price on that? And how do we make sure that people understand the importance of it? And this will be costly if the product isn't fit for purpose. So if you're constantly having to work with products that just don't work in these environments, that's going to cost you a lot of time and resource. So how can we meet in the middle? How can we make sure there's the right level of product innovation that doesn't spend vast amounts of money? But how do we also make sure there's a wraparound service that can support the right product? And that's the space that we're working in. I'm going to hand over to Harry now. He's going to talk to you about kind of two mechanisms that we've used to kind of help to support our learning, and will hopefully help you going forward. Thanks, Harry.
Thanks very much, Lynne. And again, thank you very much for the opportunity to be here speaking to you today. It's really fantastic to be here. I'd like to start off by telling you a little bit about one of the tools that we've developed in conjunction with UNICEF and with input from many, many others as well, which is a target product profile for oxygen concentrators. And more specifically, it's a set of desired characteristics, performance characteristics, for what might be the ideal oxygen concentrator design that would be fit for purpose in low resource settings. So it's got both minimum specs and optimum specs in there, and design considerations around robustness to environmental and poor power conditions, energy efficiency, and also usability considerations, which we know are a huge factor in making sure that oxygen concentrators stay operational. So it's the result of interviews and workshops with over 100 clinicians and technical experts, including biomedical engineers and technicians, many of whom are on the call today, to iterate through its development and make sure that we really get as many voices and experiences and expertise involved in these conversations when we've been developing this TPP. So we'd love for you to be able to download the TPP after this session, and perhaps actually, Lynne, you might be able to share the link in the chat now as well, but we will share it after the session. And we would love for you to download it and have a look through what some of those specifications are. You know, are they robust enough for the environments and experiences that you have in your day-to-day work working with oxygen concentrators? So the objective of the TPP is really to achieve consensus among everyone who's involved in using oxygen concentrators, users, buyers, implementers, around what those ideal specifications are, and then to be able to communicate those to product developers and to support innovation in this space. So in doing so, it will stimulate the invention of a more resilient oxygen concentrator that can operate in challenging environments and ultimately, therefore, stay operational and save more lives. And in doing so, as biomedical engineers, it should support and make easier your job of maintenance working with oxygen concentrators. So how will it stimulate innovation? Well, products that meet the TPP standard have the opportunity to be listed in UNICEF's procurement catalogue. And what that means is if a product is listed in that catalogue, it's fast-tracked through that UNICEF procurement process. So it creates a huge commercial incentive for innovators to develop and design their products to meet those standards so that they can get procured by UNICEF and get their products into these regions of the world that they're designing for. I think at that point, that's probably a good point to pause and just say we would love for you to be more of a part of this conversation. So when you have a look at that TPP, yeah, please do feedback to us, get in touch with us after the session. We'd love to hear your reflections and be able to feed that in and even connect you with some of the authors of the TPP to further these discussions and develop it further. With that, Lynne, perhaps you can move to the next slide. Fantastic. So the next tool I'd like to talk to you a little bit about is a guide for oxygen concentrator usability in under-resourced healthcare settings. So why conduct a usability study? Well, we know, as Lynne mentioned earlier, that oxygen concentrators were designed originally for use in home care settings, in high-resource settings, but now they found a new purpose in under-resourced healthcare settings. But the intended users and uses and environments are very different. And so the purpose of this study was to explore first-hand experiences of nurses and biomedical engineers and technicians using oxygen concentrators and the associated accessories as well in healthcare settings in low and middle income countries. And in doing so, provide inspiration for new innovators and existing manufacturers when considering their designs and when redesigning oxygen concentrators to be fit for purpose. So who undertook the study? It was undertaken by Spark Health Design, commissioned by the Oxygen CoLab, and Spark Health worked very closely with both the Oxygen for Life initiative in Nigeria and CPHD in Kenya. In Nigeria, interviews were undertaken with 15 nurses and 11 biomedical engineers and technicians across a range of different healthcare levels. So there were 2 public primary healthcare centres, 7 secondary hospitals, and 2 public tertiary hospitals. In Kenya, similarly, interviews were undertaken with 11 nurses and 6 biomedical engineers and technicians across 2 public level 4 health centres and maternity services and 1 level 5 public hospital. The evaluation used human-centered design and a usability engineering approach. So a variety of methods were employed to help understand both what participants in the study were saying about past experiences using and interacting with oxygen concentrators, but also gathering information about what they actually do when they use these oxygen concentrators. So using observations of simulated use scenarios to gather that kind of data as well. And we know that sometimes our everyday routines are so ingrained that it's quite hard to describe or remember exactly what the pain points are. So that's why simulated scenarios were really useful in gathering that data. And I think that approach enabled an understanding of what was most important to those using concentrators, whilst also enabling us to observe some of the blind spots as well. And the output is an evidence-based guide in the form of a PDF downloadable to designing oxygen concentrators, bubble humidifier bottles and flow splitters so that they are better fit for use in healthcare settings in LMICs. The guide has 12 different opportunities to help guide manufacturers in improving the use, maintenance and repair of oxygen concentrators. The study discovered many usability challenges, of which I'm sure many of you on the call today will be very familiar with, that ultimately limit the ability of concentrators to save as many lives as they could. So the resulting designs and recommendations can reduce the burden of training and service in LMICs, whilst also increasing the safe and effective use of oxygen therapy for patients in under-resourced settings. So like with the TPP, we'd love for you to download the usability guide. And again, I hope Lynne can maybe provide the link in the chat, and we will provide slides afterwards with the link. And yeah, please get involved in the conversation, have a look through some of the recommendations in the usability guide, and tell us, do they resonate with your experiences, or have you had other experiences that we've missed? We'd love to have that conversation and include your voices. At that point, can I move to the next slide, please, Lynne? And there's just an example of 4 of the concentrators that were used in the usability study from 4 manufacturers: AirSep, Longfian, Cantor, and Nidec, of which I'm sure you're very familiar with those, and they were available locally as well, so they were sourced in country. And that brings me on to this last slide. We would love to invite you to be Oxygen CoLabers as well, and really develop our relationship with you. We've put on screen there a little summary of the ecosystem that we're working with, and you can see it's a really complicated, complex system involving many different stakeholders. And what we're trying to do is really amplify all of the different voices and bring together the right people in the right room to have conversations and advance this work. And as you can see, biomedical engineers, technicians, healthcare clinicians, product innovators, oxygen as a service innovators are all part of the core CoLab, as well as then an enabling network of NGOs, funders, other oxygen networks and governments who all can help amplify, support this work, advocate for it, and ultimately increase the amount of impact that we can have together. So Lynne mentioned earlier, we've just finished a series of learning network events, which we have recordings and we will share with you, and we'd love for you to watch some of those. We will be hosting more and more learning network events, which will be available for you to join, and we'll make sure that you receive notification when we're hosting those. We would love for you to even run a session at those learning network events and speak about your experiences, and we often get many representation from many of these groups that you see on screen, so it's a really great opportunity to really speak to a wide audience. You can also chat to our storytelling team as well. It would be wonderful for you to share stories of your experiences and you know, have a day in the life of the work that you're doing. So that's another opportunity that we could offer. And then we'd love your own ideas as well. How can we work together more closely and develop our relationship as we do this great work together? So we've put our contact details for both myself and Lynne on there, and we will share that afterwards. And we'd really love to work more closely with you. So with that, I think that brings us to the end of our presentation, and I will hand back to Amarpreet.
Thank you so much, Lynne and Harry. Really interesting work, I think, that's being done by the Oxygen CoLab. I think we'll open it up for questions now. And I'm maybe happy to kick off with a first question here. can you explain, because I think that the concept of a learning network is new, it's not necessarily super common language. Can you explain a little bit when you say that you've got a learning network and you're inviting others to be a part of that, what that means and what that looks like?
Yeah, definitely. Thanks, Amapreet. So the first kind of year of our work, we realized that people were doing fantastic work that needed to be shared. And one thing we realized, and I think that's where the CoLab has its strength, is actually what we can do is connect people to have those great conversations. So it started with, where are there people solving similar problems and how can we connect them around this problem? And that then grew into, actually, there's enough people here to create a learning network. So bringing people together around particular shared problems or shared visions, I guess, and making the magic happen between people and their experiences. It makes it much more real. It can happen in the moment. And yeah, great results come out of those sorts of conversations. And by calling it kind of a learning network, we hope to kind of formalize it so that people felt that this was a space for them, that they are connected to people. It is a shared purpose. And it kind of gives us a little bit more of a rhythm around making sure that we carry things forward. So it's more than a chat. It's a what do you act on next? What's the call to action? How do we progress things?
Fantastic. Thank you for that answer. A question from Jerry.
Actually, it's a very pathetic question after the great question you asked, I'm afraid. But I was just noticing on the usability study, looking at the different manufacturers that you selected, and I was just surprised to see DeVilbiss was not there, given their high level of penetration. Any reason for that?
Yeah, that's a really good point. We actually really wanted to use a DeVilbiss, but unfortunately couldn't find one in country. So it was more around the pace that we were working at. Had we been able to kind of have a little bit longer time, we could have perhaps spoken to others about making sure that that product was in situ. But the DeVilbiss was used to set this program up. So the team actually used a DeVilbiss to check on the initial usability questions that they were going to ask and take in country. And I can certainly connect you to Elizabeth, Jerry, to talk about that a little bit more if you're interested.
Yeah, maybe that would be great. And I'm noticing also 2 of the 4 that you're showing here are dual flow concentrators as well. Was that a conscious decision?
Yes, we wanted to try and have a spread across them, but we were definitely we were hampered by the time limits that we had.
Okay, thank you.
Do we have any other questions from the audience? And while people are thinking, Lynne, I know you guys did just finish a series on the Learning Network. Can you give maybe a quick overview on what's next?
Yeah, for sure. So we, with the kind of funding the way it's going, so we are funding Oxygen as a service and then also product development. We will maintain 2 distinct networks around those particular work streams. And then what we'll do is weave in extra sessions that are required as a result of the learning that's being shared. So for instance, there may be one around what sort of data do we want to collect to make sure we can have great global conversations, what's robust, what really speaks to the right audiences. There may be some learning networks around that, but we will have a regular rhythm to make sure that these groups constantly come together. And then what we would like to do also is kind of codify what the core components of these services are, and we'll be sharing more about that as well. Harry, have I missed anything, or do you think that's a reasonable summary?
No, I think that covers it very well.
And then maybe a last question from my side, if no one else has got anything. How do people get involved? I know you shared a couple of different ideas, but to be considered an Oxygen CoLabber, what do people have to do? What do they need?
Yeah, I think some of this we're learning as we go as well. So we're kind of really wanting to get a sense of who wants to be in this space and how do people want to contribute. So it would be great to hear from anyone in this room, you know, how you think you can contribute to this, what sort of evidence you can bring. You know, this is all about telling the right story so that we can really amplify the importance of the oxygen concentrator. And, you know, real life stories are so invaluable. So if anyone can put themselves forward to maybe be interviewed by our storytelling team, if anyone actually already has a great case study, they've got examples that they want to share. Jerry, I know you've collected a lot of evidence around, you know, failures of oxygen concentrators. You know, is there anything that we can get more specific around? So that's certainly a way to do it, and just emailing us and we can add you to our lists so that whenever we send any information out to anyone, you're part of that network. And yeah, anything at all you think you can add to this space would be fantastic.
I think, yeah, just talking to us is, as Lynne said, like that's the way to start the conversation. And, you know, as we build this CoLab, and learn as we go, we're building a wider and wider network, and we're getting to know who's involved in this space so we can make connections as well. And if there are specific areas that you're interested in or want to learn more about or experiment with, then hopefully we can connect you with the right people to really amplify that work.
I think that's a very easy way to become an Oxygen CoLabber. I know everyone at the Oxygen Alliance has lots of stories and lots of experience. And there's often a gap in the narrative that we see versus the reality on the ground. So to see the Oxygen CoLab so invested in making sure that the voices that are on the ground are sharing their stories, I think is a very refreshing take. And we're at the Oxygen Alliance really, really excited to hear that and to work more closely with you guys.
Fantastic.
Thank you so much.
I mean, does anyone in the room have any other ideas, or do people need a bit of time to reflect? Perhaps a bit of time is needed with the slides, maybe.
Perhaps. Do we have any other questions? Okay, then, as always, we will be recording, or we have recorded this session, and we will be putting it on our YouTube channel. Next week, we will go back to our usual programming with the concentrator talk, and anyone who has any questions or wants to share any further information is always welcome to send us an email. I've dropped our email in the chat, info@oxygenalliance.org. We will, in our recap email that's sent out on Mondays, we will send you the slides, and of course the slides will be on the Oxygen Alliance website as well. Lynne and Harry, you guys have both been fantastic. Thank you so much for making your contact details and presenting for us today, and making joining the Oxygen CoLab so easy and accessible for everyone here. We hope that those of you that are with us today, and those of you that, you know, were not able to join us but are watching this recording at a later date, also send us your emails and get involved with the Oxygen CoLab. Thank you very much.
Thanks, Amapreet. Thanks, everyone.
Thank you, everyone. Goodbye.
Bye-bye.
Bye.
Bye. Thank you very much.
Bye.